Hi, I'm Sarita Choudhury, and I'm here to speak on behalf of the Healthcare Education Project and the people of New York. These are really tough times. Healthcare providers are challenged to serve their communities due to tight budgets and Albany's cutbacks to Medicaid funding. Hospitals have been forced to close their doors, and behind me, Mary Immaculate has been shut down. Along with it, St. John's Hospital here in Queens. 100,000 people were treated in these emergency rooms each year, and after closing, nearby hospitals were flooded. 3,000 workers lost their jobs. The story we are about to share addresses a sense of loss that has touched these neighborhoods in Queens. We will show you the impact felt when funding cuts force hospitals that have served a community for decades to close their doors. This is a story that is becoming far too common in New York. And, as is too often the case, those most directly affected are our city's most vulnerable, the poor.
I think it was the victim of the loss because we were dealing with the poor. And therefore, nobody was willing to pay for the poor. Where else are the poor going to go? The emergency rooms are packed. People have to wait hours to be taken care of.
When you go into the hospital emergency room, it looks like a third world country. And the doctors are sending them home, and they're sending them home sick because the hospitals that are in Queens are grossly overutilized. In the past couple of weeks, we had 2 members that were hospitalized, and when we went to visit them, they were both still in the emergency room. They have been in the emergency room for 3 days. It's a domino effect. If one hospital closes, all the people that used to go to that hospital are going to go to the next nearest hospital.
And it's a tragedy that the hospitals are not here now. We talked to the governor, we talked to the mayor, who understand, but unfortunately didn't, spring into action in order to keep the hospitals open. There were generations of people that were there. There were actually a lot of residents that came to this area to train because they were from this area. You came into the hospital and there were members of your church, members of your community taking care of you. People came back to the area to learn how to train. So there was a relationship, there was an exchange, and that's not even talking about like how many jobs were lost, how many of the small businesses around the hospital suffered. And so when those hospitals closed, it was more than boarding up buildings. It was tearing a community apart.
Mary Immaculate has always been a part of our lives. The closing of that hospital was such a detriment to this community. This is a poor and working class community. Especially thinking about the asthma attacks that my mom had a few years ago, how Mary Immaculate treated her immediately. They saved her life.
I was born there. I went as a patient there. I volunteered there. Mary Immaculate was a very, very important part of my life. And when word came down that it was going to be gone, yes, it was like part of me was gone too.
Leslie, he had a learning disability. As you can see how he speaks now, since the hospital gone. He take it so hard, it's like going back, like we were sending away.
Working at Mary Immaculate, I saw my brother grow and expand as a person, as a man. That was his professional network, his social network. And he was loved and respected there. It was a family.
That was his home away from home. And when that door closed, it's like his little heart left.
But all of us are still, hurt that nothing was done to save this hospital in this community. You can't have people dying on the streets. Somebody has to take up the slack. So if it could happen here, it could happen anywhere.
I worked at Mary Immaculate, and I live in a neighborhood. My mother, as I said, was a resident of Monsignor Fitzpatrick. My father recently had a heart attack and could not go to Mary Immaculate. His doctor now is at Flushing Hospital. Shocked that how could a hospital that's been there for 130 years, that serves a community that's impoverished and underserved, close? I wondered what happened to the patients.
Trauma admissions are up by 60% in 2009 over 2008. We've had another 20,000 or so ER visits this year. The increasing amount of joblessness in our neighborhoods, we believe, is what is the driving force for the increase in trauma. The community is characterized by a large minority population, by a very large number of immigrants. Well over 100 languages are represented. When the alarm goes off, we have to respond. And when we respond, it has the effect of causing everything else we're doing in that ER to come to a halt. The CAT scan has to be held, the surgeries are held up because we may need the OR or the operating room teams. And we have not had the opportunity to change our physical capacity to deal with these issues. If left to pure market forces, we would have a Darwinian effect. Our ability to sustain these services is now in question, and we will sit down and evaluate which of these services we can no longer provide. That's a position that our community should not be placed in.
Behind me is the main emergency department, and we have seen a persistent increase, 10 to 15% increase in the volume of patients that we're seeing on a daily basis. On a given day, we expect to see 350 to 400 patients per day. Swine flu was beyond worst situation. We saw as much as 660 patients in a single day. If more trauma patients come in, there's no option but to squeeze them in as best we can. It's almost a daily occurrence. Patient comes in with a gunshot wound to the chest. We have a trauma team, the radiology staff, the nursing staff, the nursing supervisor, the OR staff, the OR supervisors, the OR nurses. Everything comes to a grinding halt until that patient's issues are completely resolved.
Run to the car.
We have just the number of people that are needed for everyone's role. If we're forced to cut, well, there are no good options. What do we do? Which doctor do we not continue to hire? Which nurse can we afford to lose?
Behind.
Seconds can make a difference in someone's life. A man came home, he found his wife lying in the floor, and he proceeded to take her to the hospital, not certain about which emergency room was the closest emergency room. They lost some time trying to find the hospital that was the closest hospital. Because of that loss in time, she slipped into a coma, and subsequently she passed.
They're just not going to get health care until they get very, very sick, and they'll really need major health care at that point.
It's inhumane. In America, we shouldn't be treating people like that. This is not a third world country. We're one of the richest countries in the world.
To ignore all of that, do you put a price on life? I mean, you shouldn't.
For Mary Immaculate and St. John's Hospital, there is no way back. The death of loved ones, the loss of trust and confidence in the system, And the anxiety for what may come next is in itself a health concern for the residents here. May their stories be the last in a tragic episode that once plagued this city.